When you're pregnant, your team of carers will offer you at different stages of your pregnancy tests that can check whether your baby is developing normally and whether there are any signs of an abnormal pregnancy, for example, a baby with Down syndrome. These tests occur at different stages of pregnancy, and I'll go through these in order. So the first occurs when you're about 12 weeks pregnant or so, and this involves a blood test and a specialist ultrasound scan, which are combined to then give you a risk or an idea of whether you are high risk or low risk for having Down syndrome or any other chromosome abnormality. The ultrasound and the blood test will also screen for physical abnormalities in your developing baby, for example, spina bifida, and this can also be picked up at this stage. All these tests are optional, and you may choose to have or not have some or all of these tests. Before you make that decision, I would advise that you and your partner have a detailed discussion with your team so that you can make the best decision for you as a couple. If the test does come back as high risk, the only way to know for certain will be further detailed tests such as amniocentesis, which will be offered to you by your team. An amniocentesis is where we put a needle inside the womb and take some fluid from around your baby and send the cells from the skin that are in that fluid to the lab to check the chromosomes. From that, we can tell for certain whether your baby has Down syndrome or another chromosome abnormality. There is a small risk of miscarriage with this procedure, between 0.5% to 1%, that's 1 in 100 of these procedures that are done, and all this will be discussed with you by your doctor before you decide whether to have the test or not. Later in pregnancy, you'll be having an ultrasound scan at around 5 months or 19 or 20 weeks of pregnancy. And this scan is to do a detailed assessment of the internal organs of your baby. By this time, your baby is much bigger and your womb will be at around the level of your tummy button. And so the person performing the ultrasound scan can have a detailed look at your baby's heart and brain and the internal organs inside the tummy. It's a very important scan, and abnormalities can be picked up at this stage. Further on in pregnancy, we may offer you an ultrasound scan if there's any concern that the pregnancy is not developing normally in terms of size, and so we can do an ultrasound scan to check that the placenta is working well and the size of your baby is what we would expect for you at your stage of pregnancy, and that the water is around the baby is at a normal level and the placenta is not low-lying. Of course, at any other stage of pregnancy, your team will offer you further tests as they're required.